Hi everyone, welcome to Unit 9 where we're going to start talking about mycobacteriology. That includes such organisms as Mycobacterium tuberculosis. This is kind of a fun unit, so stay tuned. Mycobacterium species is a major global public health concern. There are about 8 million cases of tuberculosis per year according to the World Health Organization and 3 million deaths per year. In the United States, there's about 80,000 cases per decade in the United States. Many factors account for increased incidences in the U.S., including things such as resistance of the organism, the AIDS epidemic, healthcare infrastructure collapse, and things like that. Many species cause disease, not just Mycobacterium tuberculosis. It is not easily gram-stained. They are actually termed gram-invisible because they have very high cell wall lipids and waxy acids in their cell walls. They're also called acid-fast bacillus because they are not easily decolorized with acid alcohol decolorizers, so we term those acid-fast. They're slightly curved, bent, or branched bacillus. They can be aerobic with no spores, and they may demonstrate what's known as serpentine cording. That's when you can see microscopically bacillus in chains and they form cords. Kind of interesting. That's especially true in Mycobacterium tuberculosis. Many of the mycobacteria are slow growers. That means they can take up to 3 weeks to grow. Now, there are some that are quick growers, like Mycobacterium fortuitum, which grows in about 3 days. Usually, you'll see that particular species growing on your plates about the time you're about to throw them away. Many of the Mycobacterium are smooth. They can be rough or dry and breadcrumb-like. Some are pigmented yellow, orange, or pink. Some are photochromogens, which require light to form pigment. They're yellow, orange, or pink pigments. And then we have the scotochromogens, which produce pigment in the dark. Non-chromogens also do not produce pigments. The optimal growth temperature for Mycobacterium is usually somewhere between 30 and 45 degrees Celsius, but most of them grow at about 35 degrees Celsius. Okay? Carotenoid pigments cause our organisms to either be photochromogens or scotochromogens. So here's some pictures as to what Mycobacterium looks like on a Lowenstein-Jensen agar. If you take a look at that image on the upper left, this is a picture of one of the Mycobacterium species. It's kind of dry and breadcrumb-like, and it's growing on a green media known as Lowenstein-Jensen agar. The two other images on this slide are pictures of acid-fast bacillus that are not stained with gram stain, but they're stained with a couple of stains known as Kenyon's carbofusion, where the acid-fast bacillus are red or pink on a blue background. Let's talk a little bit about the collection, transport, and storage of acid-fast samples. We do always want to prevent contact with aerosols, so anytime you're working with samples that are going to be acid-fast tested, we need to use a biological safety cabinet or a hood. Okay? Most samples collected are respiratory secretions, usually sputums, but other specimens can be collected also. We always want to collect these specimens in a wax-free, sterile container, and we want to avoid swabs for collection as well. Containers containing wax can give you false positive stains, and we don't want that. If culture is delayed, we can refrigerate the specimen. Delays over 1 hour do require refrigeration. Now, anytime we're processing acid-fast specimens, we do have to do a procedure known as digestion and decontamination. Digestion is the procedure that we use to liquefy the specimen and release organisms. Decontamination is a method that we use to kill normal flora but interfering flora. So the digestion is when we use chemicals to release the mycobacterium from mucoid specimens with the chemicals such as NALC and NaOH and phosphate buffer. In decontamination, we are going to kill the organisms in a specimen that would likely interfere with the growth of mycobacterium. Both digestion and decontamination are used to ensure optimal recovery from clinical specimens. Let's go ahead and start the discussion with the acid-fast stains, okay? These organisms are virtually impermeable to the gram stain reagents. They may be what's known as gram-invisible, or ghost forms, or beaded positive rods. We can use a couple of stains to really make it easy to see the acid-fast organisms. We can do a really quick method known as the Kenyon's carbofusion stain. This is where we had red organisms on a blue background. This is about a 5-minute stain, and it is known as a cold stain because there's no heating required, like with the Zeal-Nielsen acid-fast stain, which does require heating of the reagents. Then we have the auramine-rhodamine stain, which is a fluorescent stain where your organisms are going to appear as orange rods on a black background. This is a procedure that takes about 20 to 30 minutes. Okay? Now, either if you're using Kenyon's carbofusion or auramine-rhodamine, we always want to screen a minimum of 300 oil immersion fields. That's the number of fields that should be examined in order to pick up any acid-fast bacillus. So here's some examples of serpentine courting. The two images on the upper and lower left is an example of a gram stain, or an acid-fast stain rather, where you can see that they are curlicuing around each other. This is called serpentine courting. And then you'll notice the dry crumb-like colonies on Lowenstein Jensen. Okay? The type of media that we use is very specific for acid-fast bacillus. We either are going to use egg-based media or agar-based media, or both. An egg-based media that I want to talk about is called Lowenstein Jensen. It does contain eggs, potato flour, glycerol, and malachite green. One nice thing about malachite green is it prevents normal flora from growing on the slant, and it also prevents that, along with the egg yolks, prevent the agar from drying out, because like I said, Mycobacterium can take a few weeks to grow. We have agar-based media, which is transparent media that makes it easy to see the microscopic colonies. We can actually take these plates and put them on the microscope stage and view colonies at 10x and 40x. This media contains 2% glycerol. We can use broth medias as well to recover acid-fast bacillus. A lot of times on instruments, they use a broth media known as the 7H11. It's also known as a midget, a Mycobacterium growth indicator tube, which consists of 7H11 and bovine albumin and oleic acid. And we can use that broth media to help recover acid-fast bacillus when using a BD diagnostic mycobacteria recovery system. If you were to take a 7H11 plate and put it on the stage of your microscope, what you might see is serpentine courting, and you can see that in the upper left-hand image. You might see dry breadcrumb-like colonies as well, and that is demonstrated here on the bottom left and on the right image in this slide. There's a number of enzymatic and biochemical tests that we can do to speciate our Mycobacterium. We can do what's known as aerosulfatase, catalase, iron uptake, niacin accumulation, salt tolerance tests, tween 80 hydrolysis test, urease activity, and nitrate reduction. In the aerosulfatase test, this is a good test to identify rapid growing acid-fast organisms. The enzyme breaks down phenyl sulfate. In the catalase test, most are catalase positive. However, Mycobacterium kansasi is catalase negative. In the iron uptake test, we can determine if our bug can convert ferric ammonium citrate to iron oxide. In niacin accumulation, we are looking for Mycobacterium tuberculosis, which is positive for niacin accumulation. Then we have salt tolerance tests. Interestingly enough, Mycobacterium fortunatum can tolerate 5% sodium chloride. We can do tween 80 hydrolysis tests, which is a test for oleic acid that can be detected by gas chromatography. Then we can do urease activity, where we are using it to speciate Mycobacterium avium complex. And finally, another test that we can use is nitrate reduction, where we can see if our organism, like tuberculosis, can reduce nitrates to nitrites. So in the aerosulfatase activity test, the enzyme breaks down phenyl sulfate. We can use the aerosulfate test to identify rapid growing organisms like Mycobacterium fortuitum. With urease activity, we can use the urea wee tabs to speciate our organisms, especially those that are Mycobacterium avium complex. In the iron uptake test, we are looking at an organism's ability to convert ferric ammonium citrate to iron oxides. In the niacin accumulation test, we are looking to determine the organism's ability to convert niacin to nicotinamide adenine dinucleotide, and Mycobacterium tuberculosis is actually positive for niacin accumulation. And here I'm going to outline a little bit more testing for acid-fast bacillus. Another test that we can do is salt tolerance. We want to see if our organism can tolerate 5% sodium chloride. Interestingly enough, Mycobacterium fortuitum can tolerate 5% NaCl. Then we have the tween 80 hydrolysis test. We are looking for esterases that hydrolyze polyethylene to oleic acids visually by gas chromatography. Let's go ahead and talk about the different species of Mycobacterium. And of course, I'm going to start with the one that's probably most clinically significant, and that's Mycobacterium tuberculosis complex. This is an organism that puts populations at higher risk. People that are ethnic minorities, homeless people, prison inmates, alcoholics, IV drug users, and the elderly are all more at risk of developing a Mycobacterium tuberculosis complex. It is carried in airborne particles, so it's carried and transmissible by coughing patients. And then we can test for Mycobacterium tuberculosis by doing the purified protein derivative test or the quantiferon test. If either of those are positive, it indicates antigen exposure. The quantiferon serum test is a very specific test that measures interferon gamma, which is a substance released by white cells if Mycobacterium tuberculosis is present. Some symptoms of Mycobacterium tuberculosis would be respiratory problems such as coughing, low-grade fever, difficulty breathing, chest pain, and weight loss. Mycobacterium tuberculosis is also a complex, and this complex includes Mycobacterium africanum and all other species and other species as well. Non-chromogenic colonies can be seen at 14 to 28 days on Lowenstein-Jensen or Middlebrook 7H11, and they're going to be rough colored. We call this rough and buff. Serpentine cording may be noted with tuberculosis, and the niacin accumulation test is going to be positive. And it lacks the enzyme to reduce niacin, and that's why niacin accumulation is positive. It is nitrate reduction positive and catalase negative. If we have a patient that has Mycobacterium tuberculosis, it's a good idea to treat them with rifampin, ciprofloxacin, or isoniazid. And a lot of times they will treat these people with 2 drugs so we don't develop resistance. Mycobacterium avium complex includes Mycobacterium avium and Mycobacterium intracellular. These are organisms that have a low pathogenicity, but it is more common in the elderly, okay? And it is common in the environment. It's found in the soil, water, house dust, and they can be an important agent of disease in poultry and swine. They can be zoonotic bugs. There seems to be a close association with poultry and swine and Mycobacterium avium complex. It can also cause a respiratory disease in patients with a history of lung disorders and AIDS patients. Okay. Mycobacterium avium complex is more commonly isolated as an agent of infection than Mycobacterium tuberculosis. Mycobacterium tuberculosis can be a colonizer without clinical symptoms, but MAC or Mycobacterium avium complex can be seen in AIDS patients. It is a rapid, progressive, and systemic disease in these patients, whereas the patient has a fever, night sweats, weakness, loss of appetite, and weight loss. Mycobacterium avium is a non-chromogen. It is smooth and dome-shaped at about 10 to 21 days and is generally biochemically inert. So let's go ahead and talk about Mycobacterium kansasi, which is one that people can confuse with tuberculosis. Mycobacterium kansasi may cause a pulmonary infection very similar to tuberculosis, but it's less common than tuberculosis and less common than Mycobacterium avium complex. It can be a second organism of the Mycobacterium genus to affect AIDS patients. It's not usually a problem for healthy people, but it can be seen in leukemic patients, and generally it is not contagious. Mycobacterium kansasi is a photochromogen that grows at the same rate as Mycobacterium tuberculosis. Because it's a photochromogen, it will produce a yellow pigment in the light. Okay, it is niacin negative and catalase strong positive, and those tests differentiate it from Mycobacterium tuberculosis. Mycobacterium gordoni is not typically a pathogen. It's often encountered as a contaminant in tap water, and that's why it's called tap water bacillus. In fact, when I worked at Bryan Hospital in the microbiology laboratory, we had a situation where all of our acid-fast slides were positive, and then come to find out our tap water was contaminated with Mycobacterium gordoni. Anytime you have several acid-fast positive samples, you should be thinking there's a mistake, because there shouldn't be a ton of positive acid-fast samples. Now, Mycobacterium gordoni is a scotochromogen, and it has a deep yellow-orange pigmentation. Okay, catalase positive, urea and niacin accumulation negative, and nitrate reduction is also negative. Mycobacterium fortuitum complex are the rapid growers, and this includes Mycobacterium fortuitum, Cheloni, and abscessus. These are all very rapid growers, and they can cause all types of infections, but usually not the lung diseases or respiratory diseases. They are found normally in water, soil, and dust particles, and they often grow quickly on routine media. Usually we hold most cultures for 3 days, but you might see these starting to pop up on your plates on the 3rd day. I'd recommend, if you see this, that you do an acid-fast stain. You can also do an aerosulfatase test, which is going to be positive within 3 days. Keep in mind, Mycobacterium fortuitum is also a non-chromogen. Mycobacterium marinum is also known as fish tank granuloma, and Mycobacterium marinum is associated with fish and aquarium diseases. This is the cause of cutaneous infections from skin trauma, and it is associated with fresh and saltwater environments. Usually people that have Mycobacterium marinum have lesions, and these lesions start to appear 2 to 3 weeks after coming in contact with Mycobacterium marinum. It does grow optimally at 30 degrees, which is a little bit different than other Mycobacterium, and it is a photochromogen. When I worked at Bryan Hospital, we had a seal that came in from the Omaha Zoo, and it had lesions on its body, and come to find out the lesions were Mycobacterium marinum. Mycobacteria ulcerans is the cause of ulcerating infections of the lower extremities. And this is kind of limited to tropical areas like parts of Australia and Africa. It is a slow grower. This organism requires 6 to 12 weeks to grow. It's not going to grow at 37 degrees, but it does prefer 33 degrees Celsius. Finally, we have Mycobacterium haemophilum. This may be an opportunistic organism in AIDS patients or people that have Hodgkin's lymphoma or transplant patients. It does require hemin or hemoglobin, hence its name, or ferric ammonium citrate for growth. The 7H11 media will have an X disc placed on the media for recovery of this organism. It grows optimally at 28 to 32 degrees Celsius, and it can cause lesions in immunosuppressed or transplant patients. So this is Mycobacterium haemophilum. Here what I've tried to do is kind of list the growth rate in terms of days, and then whether or not they are photochromogens or scotochromogens. So I'll give you just a few minutes to look this table over. But as you can see on the table, some things take a long time to grow, like tuberculosis, and other things like Mycobacterium fortuitum usually grow in 3 to 7 days. So take a moment to look at this table. One of the best ways that we can identify the genus and species of the Mycobacterium is by doing DNA probes. It's a little bit faster. This only takes a few hours to do as opposed to all those manual tests. This is a chemiluminescent test that reads relative light units. Okay, so what we do is we test unknown DNA of isolates against known antibodies of Mycobacterium avium complex, Mycobacterium tuberculosis, Mycobacterium gordoni, and Mycobacterium kansasi, and these come in kits. Okay, if you see high relative light units, it does pretty much confirms the identity of the bug. Okay, so what we do is we take unknown DNA or RNA, and it's going to connect with its corresponding antibody and acridine esters and emit light. So if you have high relative light units, it is a positive for that particular kit, and if you have low relative light units, it is negative for that kit. So for example, if you use all 4 kits, the MAC, the MTB, Gordoni, and Kansasi kits, let's say your RLUs are low for 3 of them, but they're very, very high for tuberculosis, then it means that you are dealing with the tuberculosis, and that's based on your DNA, or the DNA of the microbe actually. Anytime we're dealing with an acid-fast organism that's leading to infection, we always want to treat them with 2 antibiotics to prevent resistant strains. Some primary drugs are rifampin, isoniazid, and ethambutol, and some secondary drugs are kanamycin and cycloserine. Okay, there's actually a nice table of this information in your Mahan textbook. Okay, the treatment goes long beyond negative culture, so you can be treated for up to a year. One thing that's bad about rifampin is it's very hard on the liver and it turns your urine red, but the treatment can last up to 18 months, and that is how we treat Mycobacterium infections. All right, well, I hope you enjoyed this lecture. If you have any questions, please reach out to me. That's it for Mycobacteria.